Let's review some of the common diagnoses and some myths that people hear about different things. They'll say they'll wake up and I think I got shoulder bursitis.
Right.
What is bursitis in the shoulder?
Bursitis in the shoulder is irritation that occurs when the rotator cuff rubs on the undersurface of of one of the shoulder bones. The part. Think of the bone that fills out your.
The model there.
It's called the acromion, but it's really I tell people, think of the bone that helps fill out your sports coat, and it goes out to the side. And when the ball rotates or rolls in the socket, as the arm lifts up, the bone can rub on the undersurface, and sometimes this pinches the soft tissues or the protective coatings around the muscles, and that's referred to as your bursa. And so if the bursa gets inflamed or gets pinched, then it's referred to as a bursitis.
Okay.
Anything with an itis is just inflammation. So if the bursa is inflamed, it gets bursitis.
What about bursitis versus tendinitis?
I tell people that bursitis is the first stage, tendinitis is the next stage.
Oh, okay.
So there's a transition. Bursitis is something that happens maybe from a minor injury or a minor overuse phenomenon, but as this becomes more and more entrenched, as people are experiencing symptoms become a little more chronic, then the tendon that is right near the bursa, it takes on some of the inflammation and it starts to become irritated as well.
So that's the kind of the second stage that develops.
Exactly.
This term impingement, what does that mean?
Impingement occurs when the ball rolls in the socket, such as someone who's doing the repetitive motions where they lift their arm up over their head, and as that happens, as the ball rolls, think of a pinching that occurs between the rotator cuff and the undersurface of the shoulder blade bone. And as that happens, that pinching causes the bursitis, causes the tendinitis, and it causes friction to build up.
And then the next stage of that would be after there's an impingement and tendinitis, would commonly progress to something like a rotator cuff tear.
Right. Correct. Again, that's when we think of that, the jeans are getting thinner in the knee. We're starting to lose some material there as a rubbing and chafing occurs, and then it works towards a tear. It's a continuum.
And there's different grades of that. So you can have kind of a mild tear, and then you can have a major tear where there's across multiple muscles, and that's a little bit more involved, correct?
That's correct. That's either someone who had a little tear and fell maybe, they slipped in the snow and put their arm out to brace their fall, and that little tear all of a sudden turns into a big tear. Or it's someone who just kept on doing their activities, having some achiness, and as time went on, that tear became bigger and bigger and bigger just from use.
And what is this term frozen shoulder? People hear about that. What is that?
Frozen shoulder it can be a real problem for people, and what happens with frozen shoulder is the capsule that protects the shoulder joint will become stiff. Now, if we think of how the bone sits in the socket, once we get past the balls, the two bones touching each other, then we don't go right to muscle. We have what's called a capsule. And the capsule is a protective wrapping, like a saran wrap that goes around the two bones and kind of keeps them snug together, and then the muscles are on top. And that capsule becomes irritated. It becomes inflamed. Then it can stiffen and tighten and shrivel.
And the shoulder gets stiff.
And the shoulder gets stiff.
Okay. Great. So we heard about some of the common diagnoses of the shoulder. When we come back after our break, we're going to hear some of the treatment options and some of the ways you can prevent these problems from occurring to you.
Just like the Air Force Thunderbird pilot I flew with, I have to make split-second decisions as a top fuel driver. Hi, I'm Brandon Bernstein, driver for Kenny Bernstein's 2010 Copart Lucas Oil Top Fuel Dragster. To make it in the NHRA, I've had to work hard, stay focused, and make smart decisions along the way. To reach your goals, you need to think straight, stay on track, and give your very best effort in everything you do. Make the right choices today and be ready for the challenges tomorrow. This message brought to you by the U.S. Air Force.
Welcome back to You and Your Health. I'm your host, David Bertone. Here today with our guest, Dr. Brian Torpey. Dr. Torpey is a board-certified orthopedic surgeon, and he's here to speak about the shoulder joint and the many different injuries that occur to the shoulder. Dr. Torpey, again, thanks for joining us.
Yes, good to see you, Dave.
So in the first half of the show, we talked about some of the common problems. Now, a patient comes to you for the first time. What is the common things that you would typically do for these people with shoulder pain?
Well, usually what I want to hear right off the bat is how long the shoulder's been bothering them, and what is some of the history or the things that they experience when they're using their shoulder. if I want to hear if they actually had an event that caused them to have some shoulder pain, or if this just kind of started to develop out of the blue. I also want to hear what they do recreationally. Are they athletes? Are they more homebodies? What do they do for their employment? All that information gives me an idea as to what may have started or be responsible for their shoulder pain. And then I usually will ask them if they've already done anything to try and make it better. They've been taking some over-the-counter medicines. Have they been using heat on their shoulder or ice on their shoulder? And I try to get a feel for what they've responded to as far as the inflammation they're experiencing.
Okay, so the history is very important. So you do the history. What's the next step? You do a physical exam, or you need to take some x-rays? Or?
Yes, usually what we'll do is we'll do a physical exam next. And I want to check and see, have them point to the area where it hurts the most. And I would like to see what their motion's like. So I have them show me what they can do as far as moving their shoulder. I have them lift their arm all the way up over their head. I have them lift their arm up to the side. I had them put their arm in the back of in the small of their back to see that they can make motions in those directions. Then what I'll do is I'll check their strength. I'll check the different muscles, the rotator cuff muscles and the shoulder blade muscles and the big muscles of the shoulder, and I'll have them show me what they can do to resist some forces. And then I'll go to certain areas and do what we call specific tests. I'll test for specific things that give us information as far as what may have been hurt after I've kind of had an overall global evaluation of their strength.
Great. Yeah, I think it's very important for people to understand that thorough history and examination is what really helps guideline the diagnosis and then the treatment. Right away, patients will come in and say, well, Doc, can you give me the MRI? Can you see what really the problem is? And is that always necessary?
It isn't always necessary. Quite commonly, I'll have a good understanding for what they're experiencing just based upon what they tell me and then in my physical examination. And then if we need to get x-rays, that offers another answer or more answers to the question at hand and provides another piece to the puzzle. So oftentimes we don't rush off and get MRIs right away. It depends on the history and the story, and it depends on their symptoms.
So just so the public understands, the x-ray will help rule out any kind of bony problems. The MRI is a little bit more soft tissue. Is that correct?
Yes. So, for instance, if somebody comes in and has shoulder pain that started just out of the blue, and I check out their motion and everything looks good, and then I get an x-ray, I can see maybe a piece of calcium that's formed in one of their tendons, and that's the problem. So that lets me know exactly what to do, and then based upon that, we don't necessarily need to get an MRI because we already have the answers to what the issue is.
Okay, great. So that's important to understand. It's not always necessary, and if things aren't going right, then that may be another tool that you use to kind of help narrow down the problem.
Yes, exactly. I mean, MRI is to be sure. We order them a lot in shoulder injuries because we want to make sure that rotator cuff is intact.
And it's so complex, the joint. There's a lot of things that could be causing the problem.
Exactly. It's fair to say that the majority of the time when people have a shoulder problem that requires a surgery, before we head off and consider doing a surgery, we've gotten an MRI to evaluate and make sure we have the big picture as far as what are all the different issues going on in their shoulder.
Okay, great. Now, as a physical therapist, I mean, I see probably 15% of my patients have shoulder problems. What are the typical courses of treatment? So you see somebody has shoulder pain. Take us through what your thoughts are in terms of where you go with these people for treatment.
All right. Well, I like to tell my patients that the shoulder is a very forgiving joint. It wants to get better.
Okay.
Other joints in the body, the knee, the ankle, where you walk on them all day long, sometimes they're harder to get better because they're harder to rest them. But with the shoulder, it responds very well to physical therapy. And so that's basically my mainstay of treatment. I would say without a doubt that 80% of the patients that I take care of and see, at least 80% get better just with what we call conservative treatment. And that would be physical therapy, anti-inflammatory medicines, icing techniques, and then transition to what we call a home exercise program where people are taught the exercises by physical therapists like yourself, and then they transition to doing those exercises independently at home on their own.
Great. Now, there are some instances where you need to immobilize the joint, correct? Where you may put them in a sling for a while. What are some of those problems that might develop?
Well, we usually find that we need to use a sling and immobilize when someone's had a trauma to their shoulder, so a fracture. A case in point, the collarbone. Collarbone is part of the shoulder. It's certainly one of the most frequently broken bones in the body, especially when you're a child. Mm-hmm. And so whereas oftentimes we can put broken bones in a cast, you can't put the shoulder in a cast. So we use a sling, and that's our form of immobilization. So fractures, broken bones, they commonly require use of a sling or immobilization.
And also dislocations as well, right? The ones
Exactly.
that kind of come out of the socket.
Certainly in the early phases of the treatment, we want to allow that shoulder joint to calm down after it's been dislocated. So we keep it in a sling to allow the soft tissues to heal and mend before we start to strengthen the rotator cuff to get the shoulder back into shape.
And one of the balances that we have, physician and physical therapist, is trying to find that happy medium between a period of immobilization for healing and a period that we need to move them before things get really stiff. And we find that in the shoulder, that's sometimes can be difficult. Correct?
Yeah, that's an art. That really
Yeah.
is an art, and it requires a lot of communication between the physician and the therapist as
Mm-hmm.
far as making sure that people are getting the right milestones.
Mm-hmm.
And everybody's different. You know, some people need the sling for a while. Some people don't need it for too long at all.
Are there some other medical problems that add to the problems with the shoulder? In other words, people with diabetes or thyroid problems, in terms of their health history, does that matter in terms of their injury and their potential for recovery?
Yes, it does. There's those two specific phenomena or disease process, diabetes and thyroid disease, are associated with people who have a tendency to have a stiff shoulder. And so someone who has an injury who has those two specific type of diseases or disease problems, we're going to have a tendency to be a little bit more aggressive with their motion to try to prevent them from freezing up. And then there's other disease processes that can affect the shoulder too. People have osteoporosis, are more susceptible to having breaks in the shoulder, fractures, and those are also issues of concern.
Okay.